Hello and good evening. I'm Melisa Idris.
And I'm Sharaad Kuttan.
Welcome to Consider This. This is the show where we want you to consider and then reconsider what you know of the news of the day. With a record high of more than 11,000 new COVID-19 cases in the past 24 hours, factories have been at the receiving end of blame for the ineffectual lockdown. Public ire and frustration, which was initially directed at those who allowed factories to continue to operate during the MCO, have now led to calls for a complete closure of factories till the COVID surge eases. But is industry the reason for the unrelenting daily COVID case count? Let's discuss this. Dr. Farhan Rusli joins us on the show now. He's a public health medicine specialist at the International Islamic University Malaysia. He's also the director of the Selangor Taskforce operations. Dr. Farhan, good evening. Thank you so much for joining us on the show tonight. Now, I'd like to ask you to begin our conversation tonight by addressing the public frustration that's directed at factories. I mean, from a public health point of view, are factories to blame for the record high number of COVID cases and what is perceived to be a failed lockdown?
Well, that's a really good question. Now, the first thing that we must understand together is that factories themselves are not to be blamed for the increase in number of COVID cases. However, the workers in the factories are the ones that are causing the increasing number of COVID cases. Now, there's two things that you have to look at. Are the cases occurring in the factories, or are they occurring in where these people are sleeping, the dormitories? Now, if you look at it from a different standpoint, and if you look at the factories actually do comply with the SOPs. But the moment the workers actually leave the factories and they go back to their dormitories where it's overcrowded and they have, 40 people to a room, this is where the outbreak occurs. So you have to look at it in the sense, what do you want to stop? Do you want to stop people from getting COVID, or you want to stop places where these people are working at? So if you look at it from a public health perspective, you should not be attacking the factory infrastructure per se, but rather the workers of the factories and the reason why these cases are rising. And it's actually happening in their dormitories, not in the workplaces itself per se.
Okay, Farhan, but there's a link here, at least in the instance where factory workers are given, lodging at or by the factory owners. A lot of factories where Malaysians work, perhaps they're living in the community, they have their own homes and so on and so forth. The issue really is, even if we close down the factories today, would we see a fall in the numbers in terms of infection?
Absolutely not, because these people are still living outside of the factories. They are still living in dormitories. They're still living within the communities, and these people are actually engaging with one another. So if you look at it in this standpoint, where people who walk into a certain area comply with certain SOPs. So when they walk into a factory area, they do comply with certain SOPs. But the moment they leave a certain premise that does not enforce SOPs anymore, that's where the outbreak actually occurs. You don't need to be in a specific area for something to happen. Rather, you need to have a congregation of people for things to actually happen. So looking at factories per se, where these people are actually working, where usually they do not talk to each other, where they are on a factory line just packing or just doing things, and they have their mask on, it's unlikely that the risk will be that too high compared to when they are actually in the dormitories. Definitely, they don't sleep with their mask on. Definitely, they don't sleep, separated or 2 meters apart. I'm sure they share the same kitchen. I'm sure they share the same bed. So that's where the problem lies. You practice the SOPs at the workplace, but at the dormitories, you do not practice those SOPs. So it becomes a useless public health measure for you to take in the factory itself. But herein with lies the responsibility. Who are the ones who are supposed to be responsible in ensuring that these workers do not actually get COVID even in the dormitories? And definitely that lies with the owners of the factories and the people who employ them.
Okay, so if I were to just use Selangor as an example, Dr. Farhan, 80% of the clusters, 80% of factory clusters were recorded. And I'm just wondering, how do we understand factory clusters? Is it because of the mandatory testing that has come about that we're registering factories as the source of clusters?
Well, this usually happens in two ways. One is the proactive measures that the factories themselves undertake for them to actually do the testings on their workers. And number two, it's when it's an incidental finding, when these people actually contact trace to see who were their close contacts, and they happen to be workers from the same factories who are actually living with them in the same dormitories. That's why we have to look at it in this sense. When we lock down certain factories or certain areas, the places that we locked down were actually not the factories itself, but actually the workers' dormitories. And this is what I would like to point out, that cases that are found are usually triggered by incidental findings because of poor compliance to SOPs of the workers when they are actually residing at home.
Okay, Farhan,
can you elaborate what you mean by that? Sorry, Sharaad, sorry, just to ask Dr. Farhan to elaborate on that. When you say that cases are found, are incidental findings, can you elaborate what you mean specifically when it comes to the case of workers and workers' dormitories?
So let's say I do a mass testing regime in Selangor, for example. We take one of the places. Let's say we do it in Klang. So I test a lady. The lady is found to be positive. So then we do contact tracing. When we do the contact tracing, the husband pops up and he is found to be positive. When we ask the husband where does he work in factory X. Then we ask him, who are your close contacts? And he gives us a list of 5 or 6 people in the same unit as him. When we test them, 5 or 6 of them are actually positive. When we ask and do the contact tracings on these 6 people, the other 30 are found to be positive. And then we lock down the whole area and we do the testings on all these people, and we find that 60-70% of them are actually positive, who are apparently working in the same factory or in multiple factories. Usually the connecting factor is the place of living, because you have to look at it from different things, such as exposure time, such as amount of contact, such as conversations, such as the transfer of saliva. So all these things usually do not occur on the factory floor, but they usually occur in the residing, in the residences of these dormitories of these workers. And that's how we actually find where these people are actually working in, and thus categorized as workplace clusters.
Dr. Farhan, Singapore provided a very interesting contrast, because in the early days of the pandemic, foreign worker dormitories were a major source of infections, but they weren't, in fact, a major source of people getting severe COVID or even death. And I wonder if you can help us understand the difference between people, and many of young workers will not develop symptoms, or they will have very mild symptoms. How do we understand that dynamic, the difference between infection rates, those who get severe COVID or in fact need hospitalization?
Well, number one, what we have to look at is that different individuals are definitely unique. So just like how our DNA and our fingerprint works, everything is unique to each individual. So even if you throw something at someone, regardless what it is, whether it's a rock, whether it's sand, whether it's salt, whether it's peanuts, or whether it's a virus, the body reacts differently because the body is made up differently. It's very individualistic. And the way that we see the makeup of things is that majority of people who are young with no comorbidities, which means they don't have diabetes, they don't have hypertension, they're actually quite okay. They end up just having mild to no symptoms at all. And there's a big difference in the strain of the virus as well. So some strains are more infectious, but not necessarily more severe in terms of making the person develop into severe COVID. But what we can see is that now the infectivity or the infectious rate is climbing. And this is the same thing as last year. Even though infections are increasing as we approach the autumn and summer months, you will see an increasing of the COVID-19 cases popping up. However, with the introduction of vaccinations, you see the less severity of cases being reported. However, in some people, even if without the vaccines, they don't actually develop into severe COVID. As you can see, the data from the Ministry of Health, where they say 97% of them are actually recovered, and these people are actually quite okay, and most of them are asymptomatic.
Right. Okay. Dr. Farhan, how is the Selangor Taskforce operations thinking about factories and factory clusters? Do you agree with MICCI's move to allow for factories to continue operations during the EMCO?
Honestly, personally, I do not agree with what MICCI has done. However, there are certain sectors which need to be open. When you talk about the food and the food sectors, and this is about the formulas, the baby formulas, the bread, the staple foods, sugar, flour. So these are things that has to be kept open, because if you don't have that, then you have food insecurity crisis, which is much, much more worse. However, we see certain sectors which they deem to be important, but from a health perspective, we can actually live without. These sectors should not be kept open. But I would like to stress that it's not just about the matter of closing down factories. That is just like a stopgap just for a short while. Rather, you have to look at it from a holistic kind of approach. When you stop the factory from working, what is your approach from the dormitories or the workers' areas? How are you addressing that? And that falls under the Human Resource Ministry. So this is why we say the whole of government, whole of society approach is so pertinent in these times of pandemic, because you know that there's no one ministry that can actually solve or help reduce the number of cases. It's actually a multi-ministry and multi-agency type of leverage that you must actually go on and work on it together. Now, I expect that with
sorry, Farhan, if I could just jump in there. There's a very popular notion that if we shut down all the factories and we had a total lockdown, meaning it actually was complete, that in 2 weeks we would have a falling rate of infections, and that everything would in some ways be on the downtrend. What is a realized scenario, even if you had such a total lockdown? Would then opening up just lead to a bounce back in numbers?
Well, this is the case, right? You lock down the factories, but you keep the workers in the same dormitories. So the virus is already there. So it's still just going to keep spreading around. And when you open up in 2 weeks, the numbers are down because you're not doing enough testing. Now, definitely, if you don't test, you won't find the cases. It's just going to not solve the problem. It's just going to be an artificial deflation of numbers. What we call it is just skimming off the top, just to please certain quarters, telling people that, look, with the lockdown, that the numbers are going down, that it's working. But we know that it's not working because you're not testing the people who need to be tested. Again, I would like to stress, the factories are not the ones that are actually carrying the virus. It's the people who work in the factories that are actually developing and actually contracting the viruses. So you need to test these people regardless whether you shut down the factories or regardless whether they are actually in the dormitories. You have to get these people tested. You have to isolate them so that you can bring down the numbers in the most realistic way possible.
I hear you when you say that, the overcrowded dorms need to be addressed, and that is, of course, under the purview of the Ministry of Human Resources. But in terms of public health interventions, what would be the best way to avoid, clusters from dorms?
Well, the first thing is that you have to ensure that these people are actually left in a certain, what we call bubble, or where they are actually tested first. And then once they actually confirm to be negative, then they are released into that work bubble or work area. And you're not allowed to let them mix with other people. I mean, we are 1.5 years down the line, and there's so many different strategies that can be employed. But the sad thing is that we see that none of the strategies are actually being undertaken by the relevant ministries. Isn't it about time that we use up the emergency ordinance and the MCOs that we've done over multiple times? I think it's version 3.1 plus now, that we still have not solved the basic fundamental issues, which is FTTIS: find, test, trace, isolate, support. At the same time, these people need to get vaccinated as fast as possible. That's why the state of Selangor is pushing and has always been pushing about the need to vaccinate what we call and term them as economic frontliners, so that we can actually block these people from actually being more developed into clusters in the future. And this is the strategy that we must adopt. We must do it as fast as possible.
Yeah, okay. Sharaad, did you have a question for Dr.
Yes,
Farhan?
one last question. Considering that the disease is now said to be endemic, is the strategy that you just enunciated a little too little too late?
Well, I think before you can actually use the term endemic, you have to understand what it actually really means. So an when you categorize something as endemic, it means that you have now come to terms that this virus is never going to go away. So just like how you live with dengue, you live with chickenpox, you live with malaria, that's how endemic is going to be. But before you can get to endemic, you must suppress the numbers to an acceptable level that you think that your healthcare facilities will not be overburdened. So definitely when the Ministry of Health came out with the statement that in 2 weeks that the numbers are going to be suppressed, 2 days later saying that no, it's going to go shoot back up, you can never talk about an endemic at this time, because what is the number that you think is comfortable for it to be called an endemic? Is it 1,000 cases a day? Is it 1,000 cases a month? Is it 1,000 cases a year? There's a certain threshold that must be established for you to say that, look, if this is the cases that we can accept in a single day, then it's going to be termed as an endemic. Anything beyond that, then it's still going to be called as an outbreak. Until we get to this level, until we get to this number, there is absolutely no way that you can actually classify COVID-19 as endemic, because as of right now, it's completely out of control.
Thank you so much for helping us think through this complex topic. That was public health medicine specialist Dr. Farhan Rusli on the show. We're going to take a quick break, but more on the issue of factories and COVID clusters in just a couple of minutes. So stay tuned to consider this.
Maka lebih sukar untuk COVID menjangkit kita.
Untuk tempoh 2 minggu ini duduk di rumah. Kalau kita boleh laksanakan KKP Kendiri dan keluarga,
saya kira insya-Allah kita boleh berjaya. Akhirnya kita menang.
Perang COVID-19 masih belum berakhir. Dalam kita berusaha memutuskan rantaian wabak ini, kita jangan terpedaya dengan virus maklumat palsu. Simak fakta melalui www.astroawani.com atau aplikasi Astro Awani. Teruskan berdisiplin, ratakan lengkungan pandemik ini.
The third wave of COVID-19 has taken us by storm. There's no room to take anything lightly. Everyone must follow all the steps to stop the spread of COVID-19. Social distancing, face mask, follow these steps, this SOP with the utmost discipline. Together, we can flatten the curve.
Kini berwajah baru.
Ini pula susulan khas pesawat Back Air di Kazakhstan. Pesawat berkenaan dilaporkan tergelincir 2 kali.
Notifikasi berita terkini dan navigasi mudah. Podcast dikemas kini dengan berita dan program.
Rebirth, Reformasi, Resistance and Hope.
Serta video tanpa had dengan scroll tanpa henti. Buat turun aplikasi baru Astro Awani sekarang.
Semua yang terjadi adalah berita, tetapi tiada siapa yang boleh bawakan yang terkini dan tergempar seperti kami.
Dilihat hanya memberi wang tanpa matlamat yang tepat. Dia tidak melakukan apa-apa kesalahan.
Untuk mendapatkan jawapan yang bermakna, kita perlu soalan yang tepat.
Amat sedih dengan apa yang berlaku ke atas.
Tiada ruang untuk berita palsu.
Negara kita telah merekodkan kes harian baru sebanyak
hanya fakta yang diberikan.
Amat penting untuk meneruskan perjuangan negara melawan pandemik ini.
Sentiasa memastikan suara anda, suara rakyat didengari.
Kenapa?
Hi, thanks so much for staying with Sharaad and I on Consider This. However, if you've just joined us on the show, tonight we're discussing how public health interventions into the industrial sector can be more targeted. We'll continue our conversation. Now we have Datuk Cheng Kiat joining us on the show. He's the president of the Malaysian International Chamber of Commerce and Industry. Datuk Tan, good evening. Thank you for being on Consider This tonight. Can I ask you to address the public anger? There's so much public anger and blame that have been directed to factories for what the public perceives to be the reason behind record high number of COVID cases. I'm wondering whether you think the criticism is fair.
It's not fair. It's too biased. If you look at most of the large international manufacturers and industries, their standards are very, very high. And they easily comply, and they are very mechanized, very automated. So in terms of SOPs and social distancing, they definitely comply. And they are all of international standards, So, of course, there will be some companies that are actually the culprits who don't provide proper accommodation, proper dormitory, proper, hygienes and canteens and all kind of things for their workers. But I think the majority who want to do business and with the spread of the COVID would definitely put into practice a lot of the measures that are necessary to curb this spread. Because if you don't control this spread, there's only one way, and that is to shut down, or people will be so sick that you can't produce. So I think people on their own, will know what to do. Plus, all our members are mostly big international companies. Today, I spoke to all my 6 chairmen. Penang, they control big companies, Ipoh, KL, Johor, Sarawak, and Sabah. Even though throughout the whole country, I would say 50 to 70% of factories are shut down, But, it's suffering. Livelihood is a huge threat, and it's at the expense of all these people. It's in the billions, just speaking to the furniture export company alone, their sector do about 12 billion a year. So each month is about 1 billion. But, and already so many factories are shut down, yet, the COVID is spreading like crazy. Today we've got 11,000. So it clearly shows that it's no longer effective. The viruses have left the factories, if at all there were some in the initial stage, like Singapore, they quickly addressed it. It has gone to the community. Some might call it a endemic now, but some may not. But it doesn't matter. It's spreading all over the place. So shutting down, continue to shut down industries will be just going against livelihood. And soon, people will be so desperate, they lost faith, they will not cooperate, the whole system will be chaotic and not working well, not working positively. This is my view. I think it is important.
Dr. Tan, if I can interject, I'd like to ask you about MICCI, because MICCI has also received a lot of criticism, saying that their list of what is essential and not essential, the exemptions that have been given have not been either completely transparent or they have favored certain things. I mean, do you agree? Has MICCI provided the best, strategy so far?
They cannot determine what is essential and essential. I give you an example. My MICCI chair lady in Johor, she has 6 factories. Only 1 factory has got a license under MICCI. The other 5 don't have. But she cannot operate just one because it's a chain. It's a whole supply chain. They're all connected. The packaging, the plastic, the iron, the steel, it's all connected. And if you start to say what is essential and what is not essential, it's impossible to export. And most of them are exporters. And they can't supply to the buyers overseas, So if you cannot determine what is essential and what is non-essential. So forget about that. Let them open. My recommendation is let them open and then enforce. Pull out your enforcement to check on compliance to SOPs. And also, you cannot have one leg fit all, one size fit all, because some industries have totally no cases, like some of the international companies. Why do they become a victim of this, draconian rule that everybody shuts down? Attack those that are responsible for not following, but those that have got good practices, let them go on. The economy must go on. We have reached a stage, a very acute stage now, and losses are by the billions. How long can any kind of country depend on this? Cannot. We got to start opening up.
Dr. Tan, so just before we spoke to you, we spoke to a public health specialist, and he pointed out that actually factories are complying with SOPs, that most of the transmission doesn't happen on the factory floor because of the compliance. But where it's taking place, where the clusters are forming, is actually the dormitories, the workers' dormitories, where SOPs cannot be complied and social distancing cannot be observed. I'm wondering, given that, whose responsibility is that, if not the owners of the factories, to curb or to cut down on workers' clusters, even if it's not happening on factory floors?
Yeah, this is called targeted lockdown. That's why I say MICCI and our police force, enforcement forces need to go and watch all these companies that don't comply and get them to isolate them and target them and shut them down, but not at the expense of everybody else. Yeah, so it's not a system-wide, draconian rule. It has to be targeted. Yeah, I agree with you. Some culprits are there.
Yes,
and they're giving the industry a penny.
Yeah, CK, I want to ask you about precisely the different types of industries and the damage that's been done. You say the situation's acute. The German and Japanese chambers of commerce have written letters explicitly stating the problems. Could you tell us, for many of the in the public who think that shutting down factories is a simple matter, shut them down now, then switch them back up later on. What exactly should they keep in mind?
You can't do that. These are people who have no idea about manufacturing. You cannot do that. Business cannot be on and off. We don't have that switch, to shut down on. We got to prepare. We got to keep process going. Like even if we mandate say 50% workers, you can't, because the whole manufacturing, like Rafida Aziz says, you can't do that. If they need 100 workers, they need 100 workers. Maybe you just putting a bit more distance and spacing, that's about it. But you cannot say, okay, 50 people turn up and then you go into production. You can't do that. So let us who are not non-manufacturers and industrialists, don't decide for them. Yeah, don't decide for them. And let me tell you this. You look at all these countries like Singapore, England, next Monday, open. Most of the countries are opening up. My friend who has got 6 or 7 factories exporting furniture, he has got factories in Indonesia. I asked him, I said, Tan Sri, how are the Indonesian factories? They are non-shut down. But Malaysia all shut down for the last 60 days, costing them millions and millions of dollars. But Indonesia, their factories are not shut down. So I asked him, how about the COVID cases in Indonesia? They are just as much, in fact, more than us. But they don't lock down like that. They don't shut down like that.
Yeah? Given that the manufacturing industry or industry in general is facing billions of dollars worth of losses, how has the take-up been for vaccination? I know there's a separate track for manufacturing vaccination. Has the take-up been encouraging?
Yep, I think Malaysia has done well. We've reached 400,000 a day, although our aim was 300,000. I think the vaccines have all arrived. So, let us, in the next few days, quickly roll out the vaccination. Vaccination is still the best way to go. Now you got ivermectin, you got other ways. Continue to wear your mask and all this. Don't forget that this virus has mutated, they have transformed. There's recurrences, so you cannot catch up. I tell you, we have to accept it like common flu, whatever it is, and manage it for the rest of our lives.
Yes, but our employers, are manufacturing factories paying for their workers to get vaccinated? Is the take-up high?
Why not? They all have money. Before they run out and shut down, you get them to do it. They will do it because their business is so big and they can easily afford that. They can easily afford that. They will do it.
Okay, thank you, Dr. Tan, for joining us.
They just want to do business. So please get the government to open up and don't tell them what to do. They know what to do, lah. Yeah, trust them. Yeah, they're putting a lot of money. Their business is huge. Right. Let them do what they are best at doing. Yeah.
We hear you. Thank you so much, Datuk Tan, for being on the show tonight. That was Datuk Tan Cheng Kiat from the Malaysian International Chamber of Commerce and Industry. That's all we have for you on this episode of Consider This. I'm Melisa Idris.
And I'm Sharaad Kuttan, signing off for the evening.
Thank you so much for watching, and good night.
Good night.